but we are here to finish up the part B of that presentation. Doctor, again, we're discussing some people who fear to go for screening because of the result they don't want to hear. They don't want to be told they are positive.
Yes.
How can we change this mindset in our communities? And how do you normally handle that at your clinic?
Changing the mindset, to me, I would think it should accompany different entities. Because also coming here is one of the reasons when we give knowledge for people to change mindset. But again, it encompasses very many people. The doctors themselves cannot do it alone, but it needs different parties to come in. If health talks about detection of early signs, is taken on different levels, like radios, medias. You know, people use medias for other things. But if we put health issues like breast cancer, early detection, check for this, run, then this one would be the best. You know, when a person gets to know and we tell them that this is something which can be treatable, because if a person gets a lump, the next thing you will think it's a cancer, and then it stays with the lump for 4 years, and then it turns into a metastatic cancer. But if the lump was small and it's just a fibroadenoma or something in the breast, which can be removed and prevented into turning into a cancer, and this should be through health education. Health talks, we get these live streams of how to detect cancers. What can you do if you get a problem? Then we pass through our Facebook. If information is sent on different medias, then people get to know about it. The people who have issues are the ones most especially deep in the village. A person who has knowledge will go to the hospital, but a person will get a lump in the breast, and most of these, remember, they are coming from the ducts. So a person will breastfeed, and then he gets issues, and then the breast is swelling, and then somebody says, no, that is clogged milk, and by the time you detect the person has a cancer. I told you these things can be localized, and they come from the ducts and the lobules of the breast. So if knowledge is shared on every media, and if knowledge is shared from different people have knowledge and they sleep with it and die with it. That's the problem. If we get channels like these ones where knowledge is shared, and then they can be streamed for people to understand, then it creates awareness. Because the person who is going to see this video will post it to another, and you find it has reached very many people. If also communities gather up and gather people to teach them about different signs of different diseases, and if also in hospitals we continue to echo and put up posters, put up information about the different diseases and how they can be detected, then also awareness, telling people how they can examine their breast for any change. A person will see a change on the breast and says this is normal. Remember, the breasts are not equal. I think everybody knows that. One of the breasts is big, so you are supposed to know, is there a change on my nipple? Is it dimpling? So there are very many things. One thing we need to know is spreading health education, self breast examination, and early detection, and you run to the hospital. But most people fear to go to hospital because they will be told else. No, that should be taken out of their mind through continuous health educations and talks.
Talking about risk factors and prevention.
Yes.
What are some of the major risk factors for people that develop cancers? And you earlier talked about genetics, dietary, lifestyle,
yes,
and other significant contributor. How serious are these risk factors really?
Risk, like as I told you, the cancer itself, nobody has come to know that this is the right cause, but it's attributed to risks.
mm,
So I also talked about, I think I forgot, I was supposed to talk about
mm,
obesity,
mm,
people who get late menopause. Because
mm,
remember, this cancer is also attributed to hormones.
mm,
So there are different hormones which also come into play. But
mm,
again, like all cancers,
mm,
something like smoking, alcohol,
mm,
then we have age. Age is one of the things which also is a risk
mm,
because as you age, the cells, some cells are dying out. Then we have
mm,
people, obesity, people with
mm,
inactivity, they don't exercise. You get it?
mm,
Overweight, so the tissues can outgrow themselves. Forgetting about
mm,
genetics, because genetics, we saw the BRS1 and BRCA1 and 2, they
mm,
expose you. But also these ones come in. We've seen it
mm,
that most especially issues like smoking or drinking, they can cause change in our bodies.
mm,
Then also obesity. Obesity is interrelated to hormonal changes. That's why even you find people who are too obese, they also get other hormonal issues. So if a
mm,
person is obese and then is having hormonal issues, then it can also interrelate to as a risk factor.
mm,
Then for the genetics and exposure with the history of any family history of any cancer in the family, it also
mm,
predisposes you. Entirely, these are risk factors. They don't say that they are the right causes, but they can put you to risk. As you
mm.
age, things change. You get it? When you smoke, they can cause anything, like smoking can cause any other cancer. So it's also attributed to that.
Okay. Thank you so much for that again. Um, what are some of the few preventive measures, doctor, that you can share with our viewers today?
Preventive measures.
Yeah.
The preventive measures for breast cancer, one is awareness.
Mm,
And in the awareness is how can we prevent it is early detection.
mm,
And in early detection is you encourage people to go for examination, teach people to do their self-exam, teach people to go to hospitals and they are tested. They are done
mm,
some investigations, whereby a person, if he has a lab, he can go for a scan. Then if the scan
mm,
has shown something which needs for a mammogram, it goes if
mm,
the age allows. Then this early detection is one of the things for the preventive.
mm,
Otherwise, breast cancer alone, its treatment and everything lies
mm.
in when it's detected and the stage it's on.
Okay. So, doctor, when people are diagnosed with this breast cancer, someone comes to the facility, they scan them, they take off a tissue, maybe they confirm that they have breast cancer. What are the first steps that they should take?
When a person is detected that he has breast cancer, the
Yes.
first steps one they should take as a person
Yeah.
is they need to liaise with a primary doctor to find out the treatment options, and
Mm,
the treatment options lies in the stage. Like when
mm,
I told you what is where is the stage
mm,
is and what is going to be involved, then
mm,
also to being a condition of stigma.
mm,
Counseling is needed because most of them think they are going to die the next day. Out
mm,
of your door, they are going to die, which is
mm,
wrong. But once you tell them the stage is here and this is the next option, I forgot to tell you
mm,
that also palliative is there, whereby
mm,
the cancer has spread and nothing we can do. So we
mm,
just treat the symptoms. You get it?
mm.
So the most
Yeah.
important thing is the stage. Once you found out the stage, then you can be able to talk with your client and
Mm,
then find out what is next. Because if it's
mm,
just in stage zero and preventive, that person give him high chances You know, even when you're counseling her, she will know that I have high chances of survival, because the first thing will be a lumpectomy, not a mastectomy. You get it? Then
Yes.
for if it has gone into another stage, then also the counseling and the best issue is you explain to the person the disease and how it's going to progress and the modalities to use. And then also find out what she thinks. Because I may think I'm going to do a mastectomy, and the person is not willing to get off the breast because of the very many issues. People, I think, in US, the breast is very more important than even other parts of the body. Person may
Exactly.
not expose the breast, but may expose other parts.
Exactly.
So
Exactly.
when it comes to Uganda, other parts are protected and the breast may be out. So when you are giving modalities on what to give and on what to take, in Uganda, a person may say, let me take off the breast. And in US, a person may say, no, I need my breast. Do any other thing
Exactly.
and spare me the breast. So that one depends between the primary doctor and the person and the stage. The most important thing is the stage of the disease. That is the most important thing, and it accounts for very many things.
Doctor, before the next question, where I'm going to ask the importance of social support to these people, some people have a fear that when they diagnose them with cancers, it is a must, they must cut off their breast. However, in your explanation earlier, you talked about a lumpectomy and a mastectomy. Who gets their breast cut off and who gets a lumpectomy where they just remove a lump?
Yes, as I earlier said, that we have invasive and pre-invasive. A lumpectomy is when it's only in the ducts of the milk. In other words, it's localized. You can go in and get that lump out. You can cut out the lump, which is diseased or which has a cancer. And then other tissues or the surrounding tissues are free. That is when you've done the investigations. You've done at least a FINAB and you've found out, you've done a scan, a CT scan, and you found out there is no damage to the other tissues. Then the one who gets the breast cut off mastectomy is you do the investigations, you do your biopsy, and you find out that the cancer is spread. And then when you go to do the imaging, you find out that they spread to other neighboring tissues, like the lymph nodes and other tissues of the breast. So you cut off the breast to ensure that all this cancer is removed. That is when you found out it has not spread to other organs and it's just in the lymph nodes and in that breast. But with the lump, you find out the cancer is in the lump, the lymph nodes are free. That is when you've staged and everything. So a person who gets a mastectomy is the one who has a diseased breast and the disease has spread to the lymph nodes, and you need to remove the whole disease. And that one doesn't necessitate that it's only surgery, but other modalities may take. For the lumpectomy, it's localized, the lump is localized, and it can be removed, and the neighboring tissues are still free of any disease.
Wow. Kitegeeza omulabi waffe atuwuliriza options ziri bbiri, basobola osalako ebbeere oba abasawo genda ne bajjamu just kalampu ako oba akazimba ako akaba kafunye obuzibu. Naye kino oluso kitegeeza nti kigenda sinziira ogenze mu ddwaliro ku level ki eya breast cancer ono. Bw'ogenda wakatandika nga kakyali katono basobola okukagyamu. Bw'ogenda ng'atambudde n'ava mu kalampu ako n'agenda mu parts endala ery'ebbeere bagenda kulisala lyokka. Kyokka musawo agambye nti waliwo ne batuuka nga yasaasaana dda yava mu bbeere n'agenda ku parts endala nga balina kukusabira busabizi kubanga tebasobola kukusalako paati zonna buli kansa waagenze. So kitegeeza ki? Kitegeeza nti obujjanjabi n'endabirira n'okuwonako kugenda dipendinga ddi lw'ogenze okucheckinga breast cancer. So how important is family support to this person that has been diagnosed with breast cancer? Because I think one of the things that we are still fighting with, especially in Uganda, is stigma. In the Western world, even if they tell someone has a hole or has a defect on the heart, I mean, people are supportive, everyone is supportive. In Uganda, when each disease they diagnose you with, especially cancer, it's like someone has given you a death sentence waiting for a day to hang you. So how is family support important in this journey of breast cancer management and treatment?
One thing which I have to tell you is family remains the first social support. Before you go for anything, much as people are abroad and everywhere, even when they die, they have to come back and be buried to the family. So the
Yes.
family, when you get family support, you feel that you are comfortable. Because if I tell you you have a cancer and then the family comes in to support you, then you feel it's different from when I myself, a friend, comes and tell you, you know, I'll be there for you. There's a time I will not be there, but your family at all times will be there, whether you are sick, whether you're in good control, whether. So family support is very, very important because not only emotionally, it also, it gives you the emotional support. It also gives you that, let me call it blood. You feel you are connected to the people who are near you. Your family knows you. It can block anything if things are, if wrong information is coming in. But not only family support is needed, we only need a lot because there's when a cancer, nobody knows. Somebody does a mastectomy, doesn't know whether it was successful, and then you need spiritual support. You need emotional support. You need other social supports where we need like support groups of people who have suffered and have recovered from cancer. Somebody tells you, no, I fought that journey. You get it? I fought the journey of breast cancer. Then you become motivated. You get it? But to go back on the question, family support gives you almost 90% to see that you can fight the disease emotionally and socially. You can move well if you have your family support with you. But the other supports which are needed, for example, cancer has spread and it's not going to be, it's for palliative. So we need spiritual support, nutritional support. This person should not die when he's malnourished. Then we need the social support, the economical support. The person needs to eat. In the case of any wound or anything, we need to clean it. A person should be pain-free. You get it? Then a person should have religious support, that is spiritual support, hope, that much as you are going or you will die at one moment. All of us, you are coming in the same place. So these supports come in psychologically. In medicine, if a person is not psychologically treated, however much you give medicine, you're wasting your time. If I give you Panadol and I tell you paracetamol or any drug, and I tell you go and take it, and you ask doctor, why am I taking it? And they say just go and take. You get it? Psychologically, I have not treated you. So a lot of supports are needed to these people who are battling with breast cancer, emotionally, spiritually, socially. They need also to form groups of people who have run out of cancer, people who have battled cancer. They need groups. People can have WhatsApp. You encourage. You take a person to church. Nutrition support is needed. People, if I tell you have cancer, most people will not eat. So why should I eat? I'm going to die. You get it? So I get a person who is malnourished. And also diet is one of the things which also progress and make cancer run fast. So a lot of supports are needed. Social, spiritual. People go for sports to forget about what they are battling with. You take a person out, you know. In Uganda, I've not had rehabilitation a lot, but they are coming up. But most of the things we need to support most people don't die because they have the disease. That they die because of the stigma. Neglect. If I tell you have breast cancer, person leaves Kampala, goes to the village. But when he only had the lump, which can be removed, when he had stage 1, which can go for, or stage 2, which can go for mastectomy and other things. So social supports and other supports are needed.
So to everyone listening in, bw'obeera n'omuntu, if you have someone that was diagnosed with cancer, that's the best time for you to be there with them. It is a lonely journey. It is a silent journey, a journey with so many questions, and yet a few of us can actually provide the answer. So the best thing you can do for these people is to be around them. Again, cancer is a non-communicable disease. Togenda kufuna cancer because olabiridde omuntu wa cancer. So tufe ku bantu bano. The organization that help the people with HIV, like TASO, I think cancer patients also need to have such support organizations to make sure their hope is restored. Musawa agambye that however much you try to get treatment, if psychologically you're not treated, it may become hard for them actually for the medicine to be there to work. Doctor, do we have such support groups for cancer patients like we see for other diseases? Have you heard of any of those? Or does Lubaga have such groups and days where people can come and have those chats, to discuss their journeys, their experiences, especially to people that have newly been diagnosed?
Lubaga as a hospital, we don't have one. Because one of the challenges we have is not Lubaga Hospital alone, is most of these cancers are centrally located, or not location, but they are treated. When we get remember cancer treatment is expensive. So the government comes in. So we have a place for cancer treatment. So this is where they have groups. So when I diagnose somebody with cancer, I usually send to the Uganda Cancer Institute for further chemo, surgical, and they follow up. Because as the institution, we may not have the chemotherapy, we may do the surgery, but the follow-up of the chemotherapy and everything and the progress goes. But at the Cancer Institute, they have groups where they have different, not only breast cancer, they have also the cervical and other cancers, whereby they come. But this is something which needs to be put on a large scale to others. But groups are there, but they need to be strengthened. We need, I think, to follow up and find out the survivors and those ones who are still affected and see how they can help others. And if they can come to channels like these ones to testify and people get to know that we can really survive and do everything. I have a sister who survived ovarian cancer, and he has been on her WhatsApp. All of us, we thought she was going to die, but she's a survivor and she has recovered and everything. Now she's okay. So if these people come up and tell others, other people will come out and also do early diagnosis and they become aware of their disease.
Again, if you're there, just like recently, I had a sister here, a lady who came and testified her journey against endometriosis. And that story touched so many people. Up to now, I still get testimonies of people who say, oh yeah, I didn't know if endometriosis was treatable or not. So if you're there and you've won, you've battled the disease and won, you were a survivor of cancer, you were a survivor of, you were a surviving patient of sickle cell, all those diseases that are still new to us, please come inbox, come the comment section. You may not need to say, you may just put your contact, or you may just tell us, or you may just put your email, we shall contact you. We need to hear your story. It is such stories that are creating hope in the newly diagnosed. It is such stories that are going to create awareness to show others that indeed when you detect the disease early, you can battle and win over these cancers. I'm telling you, cancer is everyone's battle because me and you, we don't know who is going to suffer next. So the more we create an acceptable environment that accepts everyone, or the more we create more information, the better we are going to protect everyone. Doctor, as we conclude, other cancers, like I said, affect a specific gender.
Yes.
However, breast cancer affects both men and women. And this is where my worry is because, as you know, men and their health seeking behavior, we are poor. You will pay for medical checkup of everyone in your house apart from yourself. Doctor, how can we raise awareness of breast cancer among men?
Raising awareness of breast cancer among men, one thing is the cancer affects both.
Yes.
So to raise it, I think we need to remember the percentage of the men with breast cancer
Yes.
is small. So
Yes.
if we can go and find out those ones who were
Mm.
identified and they
Mm.
have,
Mm.
and they come and testify and give,
Yes.
because when you tell a man, go for breast cancer screening,
Mm.
you say, what's its role? That's for the women. You get it?
Mm.
So
Yes.
most men, they don't know. So most of the thing is what we need to do is health education.
Yes.
Sensitize them more that the
Mm.
breast is not only to the woman, breast also is to the man. People get
Yes.
gynecomastia, hormonal, and
Y-
things change. And then they
Yes.
finally find somebody that has breast cancer, which has spread. But just phone the
Mm.
lab. And so if you find a lump in your breast, you will not get
Mm.
perturbed. A woman will get perturbed with the lump, but a man will say,
Mm.
it will go away. We will not even report it. You get that man 2 years later when the thing
Mm.
is swelling. So I think we need
Mm.
more sensitization, radio
Mm.
programs, health talks, and
Mm.
also they should put these things in newspapers. Not only we should not know about politics, but health should be prioritized in everything.
Exactly. Yes. Doctor, how can hospitals, community organization work together to bring screening and education closer to people in rural areas? Because we normally come here and talk about early screening and detection, but doctor, when I got down to my village in Ikatente, Mkono, people who want to screen, but the services are there. All the hospitals are in Kampala that can have these services. How can we work as hospitals and these other NGOs to make sure we take these services to closer to the people, especially those that are not within Kampala?
One thing, if you are to bring a service to people,
Yeah.
it's something which is proposed or whereby steps have to be taken. Why do you want to
Mm.
take it? Or why? So you
Mm.
pass through different channels. So
Mm.
most of the organizations are beaten up by
Mm.
the channels they have to pass through. But the
Mm.
first thing we can do is
Mm.
we do the self-awareness.
Mm.
Teach these people self-breast exam. And when you're
Mm.
to bring a service, remember when it's an NGO, it's supposed to
Mm.
come and use its money. So
Mm.
partnering with other people, I may need to take a service, but you need to pay me. So if you
Mm.
only have money for the service and you don't have money for paying the people, for you are doing it voluntarily. So it faces
Mm.
a lot of challenges. So one
Mm.
thing is you have to first enter the ministry, find
Mm.
out its plans, because you may
Mm.
come with a plan of taking your service down, and then for
Mm.
them, they have it in different times. So what we need
Mm.
is we pattern with the hospitals. There are some hospitals where you can pattern and they do outreaches. In the
Mm.
outreaches, that's where we can teach these people what to do, where to get the
Mm.
services. But the first thing is let people know their breast exam. And in
Mm.
case they detect any problem, you tell them if you have a problem, you go to the hospital. Because also when you are to bring a service and you go in the village, you find people with a lot of lumps. You'd have identified them, but you've not helped them. So they have to go for further examinations, of which now the organization may not be able to pay for all the stages. You go for the FINAP, you go for the scan, you go for the mammogram, you find you have like 1,000. The first thing is, how do you detect it early? So this is the first message which is supposed to be taken to all villages, of which for it, I don't think it may have bumps that here and here. No,
Yes.
we need to teach people breast exam. Let the person go into the mirror, position, touching the waist, raise up your hands, see if there is any change in your breast tissue, any change in your nipple. These are the first things. Then you tell them, if you see any change, go to the hospital. Now also let us have welcoming messages in the hospital that if a person comes with a lump, the first information should not be you're going to die, it's a cancer. It can be any change. It can be a change in the tissue. It can be something which has developed. Then you start up from there. And then when you partner with the organizations, they come and then they equip the people and then also find out that they can identify. The worst thing is most of the organizations, they come and screen. Once they screen, they say we found out 100 people with lumps, and that one ends. So they have not been helped. So let the organizations which are coming for breast cancer campaign be that if I get a person who has a lump, I need to follow up to the diagnosis and up to the treatment. That is the best way of helping a person. Because if you find me with a lump and you say, I found you with a lump, go to the hospital. I don't have money to the hospital. I don't have money for the test. Then I'll die with my lump. I'll come in the next 4 or 6 years when I'm now metastatic. The first thing, how do you identify that you have a problem in your breast? Then if you have a problem in your breast, then what is next? This should be the information which is supposed to be spread everywhere. Like all other cancers, prostate, everything. What are the primary signs? If people get to know the primary signs, they will run to hospital early. And let the knowledge of stigma be taken away. People have stigma, but these days even HIV people no longer have stigma. So let the knowledge of stigma be taken away from hospitals, from the people delivering the information. Then we can have these organizations work very better.
Doctor, as we conclude, there is normally a question about men and sucking breast. In fact, one of our viewers has put that in the comment section.
Yes.
Can you talk about men sucking women breast? Because the children are complaining, but the fathers are finishing all their milk in the sense of their breastfeeding or suckling breast reduces the chances of breast cancer. How true is that?
Okay, I think men sucking, I think it's something which is also coming up related to breastfeeding. Remember, I told you the issue of breast cancer comes from the lump, the ducts, and the lobules. So most people attribute it to sucking as reducing the breastfeeding by the reduces chances of breast cancer. So men sucking the breast, it's one of the things which I've not read a lot of research, but people are coming up that it would prevent. It's like when circumcision does for the other things, but sucking of the breast is related to, the duct lets out the milk. So if these ducts are open at all times to let out the milk, you remember there are people who don't breastfeed and the milk remains inside and the ducts get clogged. So that's where the problem is. So continuous sucking of the breast is related to to the same. It's related to breastfeeding, like when, but it should not be that men should should suck breast milk for, and then they make children malnourished.
I know they were just waiting for you to confirm, such that I even get a reference. But it is also, it is just like you said, it is believed that when they suck, they open those, and they say when the milk maybe, or whichever liquid is there is not clogged, then maybe it reduces the chances of breast cancer. So to our viewers, when that information becomes clear, we shall come here and confirm, though so many people saying that. So I've seen so many doctors recommending, but we've not seen conclusive evidence that we can stand here and say, yes, when this does this, maybe it stops. But so many people are saying it reduces. So as long as you have no child you're competing for with that breast milk, for now, maybe if it is the wish of both of you,
Go for it.
please enjoy your practice. Doctor, as we finish up, what is I'm going to ask you this. I know there is a sister of mine listening in from Mubende. So mu Luganda nsaba otuddiremu omukyala akola atya self examination yeechekinga atya mu lulimi Oluganda?
Omukyala yeekebera, okwekebera okulaba oba ayinamu ekizibu. Ekisooka ekyandibadde ekyangu nti omukyala, kubanga wano oyinza obuteeraba, naye osobola okufuna endabirwamu n'okiteeka ku kisenge ne weebikkula wenna paka mu kiwato, amabeere go ne gaba ngasobola okuba ngakola ki, nga galabika. Amabeere ago n'ogeetegereza bulungi nnyo, n'osooka n'ogalaba omubiri gwago, ennywanto ziri zitya. Then jjukira amabeere gano tegenkana, ekyo bateeka okuba abakimanyi. Then n'okwata, osobola okukwata mu kiwato n'olaba, bw'okwata mu kiwato bw'oti waliwo ekikyuka, ennywanto eddayo munda, owulira ekintu kyonna ekikola ki, ekizannya oba ekikyuse ku mabeere go, n'olabawo change. N'okwata n'owanika emikono gyo waggulu, n'olaba waliwo ky'olaba kyonna ekikyuka. Then bw'omala ekyo nga kiwedde, examination endala osobola ogikola either nga weebase oba ng'oli mu ndabirwamu bw'oti, okwata engalo zo zino 3 n'otambuza ebbeere lyonna lyonna. Ebbeere lyonna ng'abantu balina amabeere manene, so bw'oba ng'olina linene olikwatako, okitegeera. Waliwo abalina amanene n'amanene agasussa obunene, so kati okwata n'owulira mulimu ekizimbye kyonna, ebyo n'owulira, then n'okwata n'eddala n'olitambuza wansi waalyo mu nnywanto bulungi nnyo, waliwo ekirimu obuzibu bwonna, then muno mu nkwawa bw'oti mu akizira n'owulira mulimu obuzimbye. Bw'owuliramu obuzimbye oba ekintu kyonna, sayini esooka. Bw'olaba olususulo olw'ebbeere nga lukyuse, nga lulimu obuntu, nga bw'olaba ekikuta ky'omucungwa, the peel of the orange, then ate ekyo kyeraliikiriza, kiba kiraga nti ki, waliwo obuzibu. Akazimba ako k'oba osanzeemu kayinza okuba katambula, oba nga bw'ogezaako katambuza bw'oti n'engalo zo tekatambula, keekutte wali eri, it's fixed. Jjukira kye twayogeddeko nti obuzimba buno oluusi obuleeta kansa buba tebuluma, buli painless. You get it? So ky'oweetaaga bw'oba weekebera kulaba ennywanto yeekyuse, olususu lukyali lwe lumu ku mabeere gonna, mulimu obuzimba mu nkwawa, tetwandiise lymph nodes, which shows the sign of spread. Then muno mubaamu akazimba konna kalimu katambula oba tekatambula. Then ennywanto yeeno oyinza kuba twagambye kansa, oluusi emyaka egiba gikuze oba wazaala dda, ennywanto eno eddayo munda eri bw'eti. Jjukira ennywanto eno erina kubeera ng'eri out, naye oyinza okugiraba nga yeesika ekola ki, eddayo munda, nga kikansa kigisika kigizza munda. So n'olaba nti amabeere gonna ennywanto zifulumyeyo wabweru. Bw'osanga nga emu tefulumyeyo nga yo edda munda, ako nako kabonero si kalungi. Then bw'osanga nga olususu luliko ewakyuse, si kabonero kalungi. Then bw'ositula emikono ne muno n'owuliramu ekizannya, ekyo nakyo kyeraliikiriza. Though mulimu n'obuzimba obumu bw'owuliramu obwetaaga okujja mu ddwaliro nga buli non-cancerous, obumu nga buli
Yes.
hormone obuvaamu, the fibroadenomas, ebintu ebikola ki, so ky'obola nti screening. Naye bwe tubategeeza ne bategeera engeri gy'okikolamu, kiba kibalaga nti nafunyeemu kano kangende ew'omusawo ayongere akole ki, anneetegereze. Naye kisinga okweraliikiriza singa olaba olususu olwo nga lukyuse nga ekikuta ky'omucungwa, singa olaba olususu olwo oba n'olaba ennywanto ng'edda munda, ekyo kiraga nti waliwo ki, obuzibu. Singa olaba akazimba akalimu ne katandika kati ne kwongera okugejja, weetaaga okujja ddwaliro. Kansa ono asobola okukolebwako, era bwe tumulaba ng'akyali mu stages eza wansi, omuntu osobola okukola ki, okuwona. Naye bw'aba agenze, oluusi kiyinza okuba ekizibu, naye nga measures weeziri singa aba akoze eki. Ate si w'abakulu bokka, ennaku zino tulabye n'abaana, kubanga people use hormones, people use other, yes. Nosanga omwana myaka 3 bamusanzeemu kansa, nosanga kubanga yajja kawulira mu buto, ajje alowooze ndowooza nkula mabeere, si ebyo byonna byonna bibeerawo. Naye nga bwe weekebera obulungi ebbeere lyo buli lunaku, si bakazi bokka n'omusajja, naawe oyisaako bw'oti owulire mulimu akazimbye, is there any change? Ate ne weebuuza nti mu famire waliyo omuntu yenna yali afudde kansa, waliyo omuntu yenna yali akoze eki, ebyo byonna bikuteeka ku risk.
Wow. Thank you so much, Dr. Daniel Mugabi. And again, if you're here and you've not yet subscribed, subscribing. The reason we wake up every Sunday morning to come here with these doctors is simply to create awareness. Where I go to, the faith that I believe in says that we are all serving in our different capacities. So we believe as medical personnel our capacities to teach people about diseases, not actually to just treat. It is so sad that so many people believe that we feel happy when people fall sick because they give us money. No, we don't want you to fall sick. That's why we come here, to create public awareness about diseases. That's why I disturb these doctors to wake up every Sunday morning to come here. They waste their data and family time to teach us about diseases. So if you're there and this is your first time to be here, I kind of ask you to subscribe, but also to pass this video to all men and women that may benefit from it. Like I said, internationally, they are saying 1 in 8 people may have breast cancer. This affects both male and females. And now doctor said even children. So I kindly ask you to pass on this video to everyone. Doctor, as you conclude, what would be your closing remarks about this topic on breast cancer to Ugandans listening in and the whole world at large?
To my country, Uganda, the Pearl of Africa,
yeah,
and also to the entire world, breast cancer is a cancer which is running rapidly, and the numbers are increasing each and every day. And the only thing we can do to see that reduce the numbers is early screening. But before you do the screening, you do your self-examination and evaluation to find out if you have the symptoms. The symptoms I talked about are those changes in your nipple, dense tissues, or the symptoms I talked about. But the issue is we should tackle or handle cancer as any other disease because it's attributed to stigma and it also needs a lot of support. Most of the people are dying because they lack the knowledge, and most of the people are diagnosed late. So anybody who is 40, 50 years, go for a breast for a mammogram. It has no issue. If you go for a routine mammogram and they check your breast, then others, you can go for a scan. Let them scan your breast tissues and they find out. Most of the people are on pills. Most of the people are using hormones. Most of the people are, these days we have even breast pump where they put, person wants his breast to look good all the times. So these are some of the things which we need to fight. But breast cancer is real and is there. To my sisters, my brothers there, I want to tell you that breast cancer can be reduced if we do what is needed. Let us spread this information to everybody. Let everybody know that I can do a breast exam. Let this one be taught to everybody. Let it be put even to syllabuses in schools, whereby they teach examination of the breast, not only teaching things even which we can't remember. So, breast examination, early diagnosis, take out the stigma, awareness should be the thing. This is the breast month, breast cancer month. So it should be, we should spread the knowledge to everybody, to the people down, because most of the people affected are not the people who have YouTube. Those ones will know and run to hospital, but we have people in the village who even doesn't know. Children most girls are delivering at 15, then later on, So there are very many things. Most people are abused. So people are in the village down where they need knowledge. People need knowledge. They need evaluation and be helped. Early detection can really help us reduce or limit breast cancer. Because if I'm detected early, then I can get to know what is the next. Thank you.
First of all, Dr. Daniel, I want to thank you so much for accepting to come here and talk to the world at large about breast cancer. Thank you so much for sharing your experience. Your time is very important. Your time is very expensive, but thank you so much for joining this ministry of creating healthcare awareness for free. And to all our viewers, again, we apologize for the earlier inconveniences we had in connection. It wasn't our initiative, but we thank you again for coming and watching this part 2. Like I always say, the Bible says, my people perish for lack of knowledge. Let's not continue seeing our relatives and loved ones die for things that we can actually prevent. When your phone gets a crack, you always put a screen guard. When your car gets a tire, whatever, you always run to fix it. The same way we love other things should be the same way we love our bodies. If you bathe every day, why does it become so difficult for you to do self-examination every day? So my call to all Ugandans and everyone watching in is, your body is a temple of the Lord. Be a good steward of that body. Take care of yourself for all the preventable diseases. Today we're discussing about breast cancer. Please take care of yourself. Self-examine those breasts for men and women. If you feel a lump, do not assume. Let the confirmation be made at the health facility. You could be a young girl and you're saying, oh, buno bubere bubeera mu baana abakula, maybe mulimu akanyusi, mpuliramu ekinyusi. Go and confirm at the health center, because like doctor said, most of these breast cancer lumps and tumors are non-painful. They are painless. You're not going to feel any pain. But I'm telling you, working in, first of all, ultrasound scan, but also now in nuclear medicine, where we look for metastases, you just don't want to look at a picture of a breast cancer that has metastasized. Once it leaves the breast, it is going to move at a rocket speed, and in just a few years, you're going to be detecting metastases in the ankle, down in the joints. That means at that stage, there is nothing we can do. Just like we support the football teams we love, the political parties we love, I kindly ask that we also take care of our bodies. To the private sectors and the government at large, just like you have prisons in every district and regions, I kindly ask that also extend cancer treatment centers to the rest of the regions. Some of our people want to go for cancer treatment, screening and everything. Musawa say that we can go to the village and screen, but we are not going to give that person transportation to come to town and confirm. Imagine a person that has had an outreach in Lira or Arua having to travel to Kampala to confirm if actually what the breast they see, because some of these regions even up to now do not have laboratories that can look at these biopsies or FNAC tissues to confirm if people are having malignant or benign tissues. To some regions that have a privately owned, and so the local people still are not taken care of. I kindly ask all policymakers, Minister of Health, thank you so much for serving us and protecting us. We kindly ask the people in Minister of Finance allocate more money for Minister of Health for non-communicable diseases like cancers. Because we talk about early detection, early screening. But what about accessibility and affordabilities? Can everyone afford that test? Can everyone access it? So that's where I call the efforts of all Ugandans, politicians, people in finance, people in the private sector, our donors, please, let us continue donating more funds, more money to non-communicable diseases, especially cancers, to make sure at least every Ugandan in all the corners of the country can afford a free screen. And maybe if something is positive, they can afford at least a free biopsy to confirm. And if they have, let us have at least a treatment center such that someone does not have to leave Lira to come to Uganda Cancer Institute for training, because for treatment. Because imagine if your relative has been put on radiotherapy and they have to come maybe twice a month for about 14 cycles. But each time you leave Arua, you're going to spend close to 100,000. How many of the population can afford that money to complete the cycles? So I still ask, I know there are resources needed, but I still believe we can afford to have these treatment centers in all the different major regions of the country. Again, I want to thank you for taking off your time to be with us this Sunday. For everyone going to church, I pray that you will meet your Lord and discuss with him. For everyone that is going through some kind of challenge, I pray that God will take you through the storm that you're going through. The Bible says he will be with us even in those valleys. Trust the Lord and everything is going to be fine. For people that are celebrating victories, we celebrate with you and we give the glory back to God. Again, if you've battled and won any disease, come and discuss with us. We want to hear that story. We want to encourage more people. We want to use it as a testimony to create hope that actually these diseases can be managed if detected early. It always sounds impossible until it's done. That was a quote by Nelson Mandela before he died. I want to wish you a good Sunday from me and everyone in my studios. Have a blessed Sunday for God and my country. May God bless you. Bye.